This is a general session. Ken just asked, he said, is this a workshop or a general session? No, I said it's a general session, but people are milling around and you know they'll come in. And so this whole general session, and we thought it was necessary to have a general session. I'm going to piggyback on some of the things that Senator Van Hollen said, that Commissioner Carter said, that's been repeated often throughout this day, how important it is to work in partnership. As we think about our work, even at the political level, Kirk and I were side by side, and we know that you had to work with both the Democrats and the Republicans. You had to, and because that's the only way that it was going to advance. I can remember talking with, one of the founders of NFI, Don Everly at the time, and we just said that around trying to get this thing over the finish line, we got to work together. We got to work together on both sides of the aisle. That's also true at the community level. We have to work in partnership. You're not going to succeed in this work being a onesie, all right? And the onesies, those folks who think that they can do it all by themselves, they don't need nobody's help, they don't last long. And because it's hard to, be selfish. And then, when your money runs out and then you need friends and then you try to call on folks who you avoided because you didn't want to partner with them because you didn't want to share. All right. And y'all heard me say in the pre-conference, I'd rather be 25% of something than 100% of nothing. All right. Because if I had my way, I wouldn't mind having that 5% that Magic Johnson has of the Los Angeles Lakers, because that's 5%. But that still would take me over the top financially, right? And it's just so important to just know how important it is to collaborate. And the two individuals I have up here are stellar collaborators, and they share, with me the vision of a more collective and a more partnership-oriented fatherhood feel. It's interesting, Kirk. Most of our work over the years, at least at the federal level, was either with the Child Support Office in many years as an adversarial kind of thing, and we were trying to kind of temper them down. But the other area was in ACF, working on the human side of things, almost as Commissioner Carter talked about this morning, in a silo, all right? Because right down the hall or right across the street was the Office of Community Development, the Community Block Grant. That's where the community action folks were, but they weren't coming to the stuff that we were talking about, Kurt, because they were kind of in their own silo. Also in that same ACF umbrella is Head Start, Human Services. We weren't working with Head Start either. I remember Ron Mincy and I and Lauren Harris, he's worked for the Mott Foundation. We went over to talk with the Head Start Bureau initially and said we need to collaborate. She one of the Head Start Bureau director at the time, once she was made aware while we were at this meeting with her boss, said that you need to talk to these guys about what they're doing in fatherhood. Her first response, Kirk, was that we're already doing that. And her boss said, you ain't doing this. All right, we want you to do some of this, right? So because again, it's like Commissioner Carter said, people believe in the mission of what they're doing, but they're doing it in a silo. And we got to work outside the silos, and we got to really look at the things that really make a difference in the lives of family. Because where they come together is that in the service system, we're all serving the same folk. Community action folks are serving the same folks that we're serving because they have as their mission reducing poverty. All right, and so you have that. Head Start, another one. That's what they're about. Healthy Start at another level is, you got to qualify for Healthy Start, but it's on the maternal and child health side. It's on the maternal and child health side. And I just thank Ken Harris for his leadership over the years through the Healthy Start Association, through his work over as community engagement vice president of the Technical Assistance Center with Healthy Start, helping to, one, not only make sure it's a part of all Healthy Start programs, and they're required to do it, but also forging the partnerships. And he's going to be doing a workshop on the Learning Academy that we did. And we still are doing to try to educate diverse human service entities who should have been working together a long time ago. It's interesting, Geneva, I mentioned this, and if Seth is watching, he'll remember that I said this to him. I said, Seth, he's the head over the HRF program. I said, when the last time you went over to the Department of Labor? He looked at me and said, well, I've never gone over to the Department of Labor. But the point is that many of the programs that we have an employment component. So why are you not talking with labor? We got to get over that. And so and I say that this is the spirit of this, what we're talking about here today. How do we leverage community partnerships? And what we're going to be talking about in particular is how do we leverage partnerships, with community action agencies. I serve as chair of the Montgomery County Community Action Agency right now. All right. And I've been doing it for the last 3 years. And so we oversee the Community Block Grant Program. We also oversee the Head Start program. And we provide all the services in the county that focus on reducing poverty, even amongst diverse populations. Ken has been Community Action Agency chair in Boston, right? In Connecticut, right? In Connecticut, all right? And so both of us, you might think, are outside of our scope of work, but we're not, because when we do our work, we still live in communities and we still have work to do. And I'm putting that out there as a clarion call to you all, that those of you who are not a part of your local community action agency, and guess what? There are 1,000 of them. You need to be on the community action board, all right? And that's how you bring the fatherhood issue there. We're also going to be talking about maternal child health, all right? How maternal child health is also an avenue for partnership. The maternal child health partner that we had for the conference was one of our biggest supporters for this conference. Just, they are committed to fundamentally doing it, and they're going to be talking about this. And let me tell you something. The partnerships that we're talking about, we have evidence to support that this is what the American people want. They want us working together, and they want us to working together to build the capacity of parents to be there for their children in many respects, in the ways in which Commissioner Carter was talking about this morning. Finding what works, making it work, and then empowering them. So at some point, sooner than later, they're off of the government dole. They're off of the government dole. That should always be our goal. I always stated that our goal at MPCL is to make sure that no child is receiving public assistance. But in order to do that, we got to work with their parents. And we've had a particular focus on dad. All right? And so, Derek, put a slide up there for me, okay? And let me give you some evidence here. I'm going to step away from here. Ken, would you put them on the stage? Okay, here we go. Now, see, I've been going to the Healthy Start, the maternal child health, and I've also been going to the community action conferences. All right, and listen, this is what they say is what we should be about, and it's backed up by the voting population in America. 2-generation approaches centered on whole family. Child focus with parent and caregiver elements, whole family. Adult focus, but the 2-generation approach is to build family well-being by intentionally, look at this, simultaneously working with children and the adults in their lives, all right? And even though a father may not be there, it don't mean he ain't there. Let me say it another way. Many years ago, we had a blue ribbon panel, focused on the partnership between Head Start and fatherhood. And we recruited several fathers from the Head Start program to sit on this blue ribbon panel that we had. And I asked the Head Start fathers, tell me something that you want us to know about a Head Start father. And let me tell you what he said. Here's what he said, Kurt. Just because I ain't there don't mean I ain't there. I want you to hear what I'm saying. He was there, but he was not documented there because he didn't want to disrupt the eligibility for his child. But fathers are involved. Look at the research coming out of CDC. They look at the involvement of Black fathers. They're involved, but they're not documented because policies preclude them from showing up to be $1 past the eligibility mark that excludes them from these support services that they need for their kid. Child care is expensive. It's expensive. Do you know how much child care is? $5,000 a month. $5,000 a month. That's how expensive it is. All right. Next slide, please. right? 8 of 10 voters agree that if you want policies to work better for families, we need different kinds of leaders that we have now making decisions, including 64% who agree, right? And you can see it's Democrat, Republican, all right? And also some independent voters. I just want to show you that the majority of the American population, it was done by Lake Research Partners, all right? And this is right after the election when they did this, and they said they want policies that work better with families. Fathers are included in families, right? That's what American people say they want. So when you go on the Hill tomorrow and you're talking to your delegate and they want to know why you're there, what you're doing, let them know that you are aware of this data that suggests that 8 in 10 Americans want policies and they want leaders to respond to policies that really focus and work better with families. And we need different kinds of leaders that we have now making those type of things. So we got to do a lot of education. Next slide, please. 3/4 of voters and half strongly agree that if we want government-funded programs that serve families to run effectively and efficiently, we need to trust families, look at this, and give them the flexibility to do what is right for their family. You got to meet folks where they are. There's no one size fits all. I come from a family of 10 children, including 8 boys, right? All of us are doing something different. All of us are doing something different, but we're doing something, that's meaningful for their lives. They're doing something meaningful for their lives. I'm doing something meaningful for my life, right? Yes, and that's what we call meeting people where they are, and listening to them to see where they want to go. Look, I want you to look at the demographics here. All right, Democrat 89%, Independent 70%, 59% Republican. Trump voters, look, 62%. Right? So don't tell me that we're in a period of uncertainty when the electorate said, this is what we want. This is about us educating and advocating and talking about accountability, all right? And using the data to help support our point of view in that regard. Next slide, please. Last one for me. There is some gap in levels of agreement based on parental status and gender, but support is strong for across the board. All right, and the question was, do you agree or disagree with the following? If we want to make sure children and families with low incomes are successful in their early learning, then we have to also invest in their parents and economic well-being. Look at that, 73% overall, 73% say yes, 60%, 67% say parents, non-parents, 75%. This is from the electorate, right? Fathers, 60%, mothers, 72%, right? But what I'm happy to say, father are over the 50% line, right? You would think that, we're invisible and that the American public don't see the value of fathers, even though we know that mothers get more Mother's Day cards, right? It don't mean that fathers don't deserve one. All right? It's just how we're culturally conditioned to think more family in the context of mother-child, which goes back hundreds of years, instead of thinking about mother, father, and child, whether or not they're married or not. All right, because that becomes kind of the factor that allows us to kind of collect data a certain way. All right, but this is all I want to say to set this up. These two gentlemen have things that they want to say that are thoroughly important when it comes to understanding how we need to leverage partnerships. But I just want you to know that what we're talking about today is in total concert with what the American people want, all right? And this data reflects that, all right? We're talking about leveraging community partnerships with community action agency. There are 1,000 of them nationwide. Leveraging partnerships with maternal child health through the Healthy Start program. There are 114 sites, all right? When the Federal Fatherhood Grant Program, Geneva, how many grant programs supported fatherhood in any one year? Okay, and what is it right now in terms of fatherhood? 100, right? About 50. You see, so about 50, but you got 114 Healthy Start. 114 Healthy Start who want to do fatherhood. Y'all should be talking with them because some of them will do what they're doing in Toledo with Avis. Avis is the Healthy Start partner in Toledo. She's not community action, right? She is community action, but the health department subcontracted her to do Healthy Start. So she's a fatherhood leader. right? She's a woman and father. She's been doing it for a long time. You need to follow these types of models to grow your programs. And also, again, I don't want to forget what the commissioner said this morning and what we've been talking about earlier, and that is to do more work in the states. That's what action is. I'm not telling you not to apply for federal money, but I'm just telling you that's not the only source, and that we can advocate for other resources. That's all I got to say. Ken, help me out here.
So I was raised that you do not correct elders, right? But because I am a junior to this young man, I support him, and the numbers are so important. This is the only time I would do this. We don't have 114 healthy starts. That's 115.
115.
I just want to make sure we count them because we fought for those. And again, all that you're talking about, this advocacy, so every single one counts, especially Healthy Start, you all need to know, is a maternal child health program. There are 115 in this nation. It is the only maternal child health program that has fatherhood as a required component. That's why we want to make sure every single one is counted. Go back. You're too far ahead of me. So we'll start there. I just wanted to share that because again, and Dr. Johnson has been with the Healthy Start program since it started. Even before father became a required component, the folks that helped establish Healthy Start, and it started with 15 programs, by the way, and grew 34 years later to 115 because of the advocacy that Dr. Johnson is talking about that we need to do to ensure fatherhood for the future. But I wanted to just also, before I start, because again, give honor where honor is due, not only this man is brilliant in what he does in front of you all, but I have gotten to know him over 3 decades, and he's a historian, and I just have mad respect for him. And so let's just give him another hand at this time. And when he was doing the awards, also Dr. Harris is here. But these men and the Ron Menzies, the Charles Ballard, who was my mentor, by the way, Charles Ballard. But these men have committed themselves to other generations, and so we're talking about intergenerational work. But they mentor people all over the country. And Dr. Harris is mentoring Dr. Clinton Boyd, who took over his organization, but he's committed to him. As these men and those that have been honored this afternoon have committed themselves to this. And so when we talk about partnerships, please take this seriously, beginning with ourselves, because we're going to talk a lot about our partnership, right? For fathers and families, and you are PFF members, you're a part of that. And so when we talk about that, make sure you respond. And so I just had to get that out of the way first, because give honor where honor is due in those moments. And so with these community action programs, again, as Dr. Johnson says, for those of us that are in our 60s, we remember when community action agency programs started out of the Lyndon B. Johnson administration. So this year marks 60-year anniversary of this program that began as a response to the war on poverty. And so again, I didn't realize, you all, that I was a community activist in my 20s, and I lived when I was a child. We moved from Memphis to Boston, Massachusetts. Hard times, racism was bad. When I was born, I wasn't considered human because it was before the passage of civil rights, all that good stuff. But we grew up in the hood, and I remember one year, you all, we had macaroni and cheese like every other week because that government cheese, yeah, but we got this free cheese, you know? We didn't know what was going on, but when I became an adult in my work, I realized that the ABCD organization, which is a community action agency, was the agency that served my family when we were going through. And it's funny that I end up being the board chair of one all these years later. So these organizations are important, and as Jeff said, over 1,000 of them are around the country, and each of them have hundreds and hundreds of partners at the local level. And so again, we should be partnering with them. And again, he's a board chair, I'm a board chair, and some of you are funded as community action agencies. And so again, you need to understand that 16 million people are served by community action agencies across the country, you all. And right now, today, there are 36 million families that need this program. And so they're out doing their job, and we're just encouraging ourselves to think about significant partnerships with community action agencies around the country. Healthy Start represents 39 states, including Puerto Rico, Hawaii. So we should be partnering with the Healthy Start programs as well. So again, keep that in mind as we talk about these partnerships. Next slide for me. Lyndon Johnson, he had a commencement address in 1965 at Howard University, and he was talking about the history of enslaved Africans in this country, and asked the question, you know, how after 250 years of oppression and chains, you can't just say you're now free, you can experience everything. He said freedom was not enough. And unless we create opportunities for people to thrive, and that's what we're talking, we've been fighting for fathers and for families. We need to create opportunities where they can thrive. And so again, keep that in mind. Healthy Start, as I said, this is a look at the nation of where all these Healthy Start programs are across the country. Again, there are reports on its impact. Go ahead and click it and populate that for me. But the Healthy Start program started as a community initiative, much like the fatherhood movement over 30 years ago. And the strategy was in the name of the first name of Healthy Start, which was a community-driven approach to infant mortality reduction. That was the idea. We want to come to the community because we believe the community can help us solve this issue around infant mortality. And they found out that it worked. And so it went from 15 programs and it grew to 115 today. It is the only program in this country, again, that requires the grant have a community component called the consortium. They have to show that they have community partnerships, that are working with the business community, that community residents are there, that mothers are there, that fathers are there, part of that advising on what's done with that money in those communities. It is the only program like it. And it's the only reason that Ken Harris went to work there 34 years ago. It's the only reason that my entire professional career has been working for a Healthy Start program in Boston and in New Haven, Connecticut, and then nationally. It's the only program I wanted to run for because it aligned with my beliefs and what I was put on the planet to do, which I believe many of you are doing the work that you do because there's something inside that's driving you. Well, we have an opportunity to create the kind of partnerships that will make it work. Healthy Start works. And that's why it got funded over and over again, even though it's been on the chopping block. Being on the chopping block doesn't bother the Healthy Start community because we've been here before, because we actually understand what to do in the meantime. Because when it's community driven, when programs are rooted in community, when there are strong partnerships, then you can keep things going because poor folks know how to keep it going even when the money runs out. It's the people at the top are going crazy. Where's the money? Where's the money? In the meantime, we still got babies that need to be saved. We still got people that need to eat. People still need to be in the house. So again, we're encouraged when we work together. Next slide. I know I wasn't supposed to put on the preacher side. I'm supposed to be Tom Ken. So community, I'm just trying to let you know how it works and I've lived it. So you can't tell me nothing different because I've lived it now. Next slide. So the Healthy Start partnerships, community action partnerships, again, and we have the Healthy Start Association, and there you have the director, Deborah Frazier is there, the executive director. Before she was a director, Deborah volunteered her time. I was a past board chair a couple of times. There are people around the country that are still committed to supporting this organization because it's the advocacy organization for these programs around the country. And another reason why they grew from 15 to 115, which is why we at MPCL are making sure that we have a national network for practitioners, for fathers and families, so that we can do the advocacy that's needed. Having representation on the Hill. When you can't be here, we need to still be on the Hill. And then also educating you on what to do when you're back home. So again, a hand applause for this organization because it represents communities and people, mothers and fathers around the country that keep that going. Next slide, sir. And so you've heard the term collective impact. And so again, we're trained in collective impact. So that's what MPCL will be supporting as we move forward together. Not just an idea, hey, let's all come together, stronger together. Because again, in the 60s, like Black Power works, but we needed more than putting up the fists about Black Power. We had to cultivate soil and change some things. And so collective impact is about all of us coming together, not losing yourself, but how do we come together, align, leverage, and maximize. Align, leverage, maximize. Say it with me. Align, leverage, and maximize. One more time as loud as you can. Align, leverage, and maximize. That's what the partnerships are all about, and that's what we know we need to do at this time because there's an urgency of now. And so the collective impact has a methodology, a form that we will be following that teaches us how to bring all the different things together, align, and work together. Not just go in the same direction, but be so infused together that we represent this power and strength. So again, bringing fathers into this space, there's a whole fatherhood ecosystem that we understand, but we need to understand it collectively. You've seen some people here, but we have partners that are doctors and researchers. And so we talk about making sure that fathers are included across that maternal care continuum. We now have data and research that back that up, because some of our partners have been using their time to build that research to show what happens when men are connected to a pregnancy, where birth outcomes can change. What happens when men are connected to that child 0 to 3, 0 to 5, 0 to 8, where they get to school ready to learn, what child has confidence. We have all this wonderful data that we need to certainly be shouting it together and making it force as a strength. I think that was my last slide, yes? Oh, let's pop. So this is what we mean, because Kelly's coming after me to really talk about fatherhood within MCH. And you've heard MPCL emphasizing this over the years. Fatherhood is not out there by itself. And so bringing it into partnerships where there's women and children, we should see fathers. If you see a child, you should think about a father. Any fathers need to be put back into view, because we've been rendered invisible. And there's many studies that we have from Robert Wood Johnson and others that did the studies 30 and 40 years ago, how we've rendered fathers invisible. So now it's making him visible is what we're talking. So just to help you that don't understand, go ahead and populate that for me. But fathers matter along the maternal care continuum. So go ahead and click for me. When you think about the maternal child health continuum, it starts from preconception, goes all the way up. Just to remind you what, when we say maternal care continuum, click it again for me. But we need to start seeing fathers across that continuum, because then we don't see them in the visit, we don't see them in the clinic, you don't see them in prenatal, but we need to start seeing them. Go ahead and click again for me. And so we're talking about seeing fathers all the way from preconception all the way to parenting and co-parenting. And so what does it look like in between? How do we engage fathers around breastfeeding, reproductive life planning, family planning, all of these things, addressing maternal mortality, addressing postpartum depression, because men also get postpartum depression, but how do we bring him in along the continuum, which is what we've been doing. Click it one more time. And so now you think about the maternal child health, think about paternal involvement. So this is what we mean, including men across that continuum. And that's the opportunities that we have, that we've been demonstrating over the last 30 years with the Healthy Start program, and certainly the work we've done here at MPCL, and ensuring that our practitioners that engage in this work understand fatherhood and MCH. And so our brother Kelly is going to come and emphasize that a bit more, because I think he's going to do a great job. I can keep talking, but I want you to come. So let's give Kelly a hand as he comes. And so. Kelly has been one of our powerhouses in the making, so he's been around doing great work for a long time. Yeah.
Next slide, please. So, as you heard both Doc and Ken talk, we're stronger together, not just because of our strength, but because of our collective wisdom, because of the different perspectives that we bring to a table, because of our expertise, and also because none of us are identical in our challenges, in our support, in our resources. And when we go back to the social determinants of health, you got Healthy Start, who has a role through the maternal health process, but we can't underscore Head Start in that education platform. So let's look at this for a second, because nobody's coming to save us. I need us to look in the room. All the iconic leaders that we need is standing in space. We need to make sure that we're in conferences together, that we are connected and not just exchanging information and never following up. Because at the end of the day, we're talking about going to the Hill. We have to remember that they work for us. And so in doing that, I need y'all to do me a favor though. I know we just had lunch. So when I say neighbor, I need y'all to say hood. And after every word I say, I want y'all to say hood. We're talking about connection, community action networks, right? So that all starts with neighbor, parent, mother, father, we can't save families without emphasizing the critical importance of fatherhood and the impact, because that is the foundation of a family, right? And so when we look at this, next slide, please. Please let's remember that we are stronger together. So these dynamic collaborations lead us to the importance of, I need y'all to picture us being in this room, but you're at work and you need to do your work. The community action networks are our Wi-Fi. If you can't tap into your Wi-Fi, then you have no supports or support systems to center us in what's most important to us, which are our children, which is the basis of our families, because that's that shared responsibility that we all have to parent in a way that optimizes all the things that we do for a community. So I'm gonna let that sit for a second, because that fatherhood EQ impact ties us back to emotional intelligence and helping us to underscore and understand that everything starts with us internally. But as we begin to learn to master our own selves, it's the interconnectivity that allows us to have the true impact in that neighborhood, in that state, in this country, and across the world. So that is where our power is at. So men and fathers with community action networks, and I'll start with Head Start. We have a unique ability because men like to play, and our skills and skill sets are different than women. So when we come into schools, and I'm thinking in Head Starts, we get to change the energy in that school just by giving the kids high fives when they're walking into schools, controlling traffic so that they see somebody who's a resource. If their father's not there, because I didn't say this, but there are 4 kinds of fathers. You got the biological father. You have the spiritual father. You have the adoptive father. And I'm not talking literal adoption, but by virtue of our kids, we adopt the kids that are in close proximity to us. And then we have the community fathers. All of us are vessels to inspire young people. And so when we don't have certain things, we just modify stuff. We make sure that it's malleable so that that Head Start organization has the support of us, just like we have their support. And let's talk about Healthy Start. Ken started us off with some quantitative data, but let me talk just for a minute, because what we forget sometimes in research, for just as much of the quantitative data, there's qualitative data that's just as impactful. So we got to do the focus groups. We got to do the surveys. And in such, we'll start to hear and talking to moms when we're able to center the child as our first priority, and they use that as a basis to build a relationship. It transforms what that child sees. And you heard Dr. Harris speak to his situation. Now we get to break this word that I dislike, which is generational trauma. And so we got generational trauma. We have trauma-informed, trauma-responsive, trauma-sensitive. I won't limit into the problems. There are solutions to that. So we're going to be healing-centered, healing-engaged, and healing-empowered. So when we normalize those things with our community action networks, because it's an exchange and a sharing of information, now we create spaces where collectively, instead of us having all these individual plans, we create MOUs that allow us not just to operate in collaboration, we are aligned, one body, we got arms doing one thing, we got our feet moving, and our brains are helping us to transform the very culture. And we're fighting not with the community action networks, but the policies and procedures that cause us to sit in competition one with another. So we got to move away from that and find ways to collectively go after money so that we as a body can take the head starts, the healthy starts, to move in a way that we elevate and optimize the strategic plan to shift all those negative indicators that are changed when you engage men and fathers in any conversation. So if we go to National Fatherhood Initiative and in the Responsible Fatherhood Clearinghouse, the research and the data talks about when fathers are engaged and involved, obesity shifts, behavior changes, children are more likely to graduate high school, they're more likely to go to college, and moms, don't throw nothing at me, but I know that you didn't like it when dad throw that baby up in the air and catch the baby, but what they was teaching them was support because they know their father would catch them. And I need us to think about when fathers are not involved. I think Kim was the one who talked about epigenetics. So if trauma can be passed down, we need to recall in the back of our mind, because so too can our warriorship, so too can our kingship, so too can our emotional intelligence and educational brilliance. It will be passed down, but we can only do those things if we understand that part of a butterfly's metamorphosis is when it goes from a caterpillar flipped upside down and can't move, right? If I go and I save it, it never transforms into the butterfly. But allowing processes like PFF and collective impact and community action agencies, we then become the the butterfly with the beautiful wings that move us into our own truth and our divine purpose, which was to operate as a family, connected one to another, all moving for the greater purpose of our communities. Next slide, please. Next slide. That's not important. So I talked about fathers and their importance, and so we're the missing link. But the other part to that in the community action networks is to understand that there are other providers in the community, local government. Doc talked about it, our DSSs, right? They are a resource because they send many of our clients over to specific agencies. So we have to make sure between them, and y'all don't throw nothing at me, but I used to be the director of mental health. I was deployed with the military. When I came back, I no longer supposedly had a job until I reminded them that was a violation of federal law, and I wouldn't mind having a whole building named after me. And so they put me in child support. 10 years I served in child support, did not want to go. But you know, they say when you tell God what you're not going to do and where you're not going to go, he laughs at you. And I believe he's still laughing. But I had an opportunity in child support to impact that entire organization on a federal level. I was the first to move forward with internally a whole team in child support committed to fathers. And I served and did that for 10 years. And as a result of that, I am contracting with that very organization that I retired from in 2019 and leveraging relationships with local government and community action organizations to be able to position ourselves to create greater impact and say it's not just about one of us, but all of us. And when we stand in that space, we get to transform workforce development and organizations like the Urban League, who also allow us to expand our impact, lengthen our impact, and deepen our impact. And I'm gonna go lastly. because I didn't want to forget the hospitals, and we talk about Healthy Starts. But let me tell you this, 2024, because of Healthy Start, I decided that the organization that I started many years ago, for us to have greater impact, I was going to go and do something that was real different. I became a doula so I can teach men how to support women through trimester 1, to trimester 2, 3, and 4. And now that, and normalizing that, one, we know that 86% of maternal health deaths are preventable when men are involved. We shift the culture around C-sections 3 to 4 times when men are involved. So I say that to say, by normalizing that and creating not safe spaces, but brave spaces that are safe for us to have conversation and purge pain, trauma, and turn it into healing, and expose fathers to community action networks, as well as inviting those community action networks in to be a part of what I call a father's haven, then we transform the way they think. Because once I know better, say it again, once I know better, so we got to do better. Everybody in here, we get it. Well, we got to find out, how do we invite more people to the table to connect with the community action networks and bring them along with us. And so with that, that concludes my time. Thank you.
Listen, everybody should be leaving out here, going forming some partnership with somebody, right? We are going to open it up for Q&A, but I also wanted to mention, and just to kind of dive even deeper in the health space, you know, one of the things that we're doing right now at NPCL, we're heading up a health initiative focused on Black men's health, right? A lot of the folks y'all serve are the very folks who I'm trying to improve their health, because we have the lowest life expectancy in any demographic. And the project is called In It to Win It. All right, in it to win it, which basically means that it's a celebration of the life of men, particularly Black men, who experiences the most disparities and chronic diseases than any other demographic. And if you understand the history of African Americans in this country, you know, it should tell you why, you know, we have the struggles that we have. But we have a chance through our programs. All right, again, it's a component part of what we do at NPCL right now. We work on health issues. When I first started, Kurt, we weren't talking about work with the health department. We were trying to find out where we fit in. But what we're finding out, and through these presentations, we fit in a lot of places. All right. And we got to bring some of these things together. What better program to start a health initiative than the fatherhood program? Because you want fatherhood programs to be around. You know, you're under the health department in Fairfax County, Mingo. You know, listen, we're in those spaces. It's just not enough of us, right? And when we come back to the conference next year, I want folks to say that I'm working in community with community action, that I'm working with the health department more vigorously. I am working with maternal and child health. I'm working with the Urban League. The Urban League used to do it, but the Urban League is not doing it a lot right now. We need to go to those Urban League conferences and do workshops and let them know that y'all should, in y'all's agenda, not forget fathers. They used to remember that. They don't do it as much now, but that's what we do all the time. And we have to remind them, and to also reach out to, again, the whole host of what Kelly called the community action system, the action agency system. It's out there. We're serving the same client. I wish I had, is Misha here? I wish we had that graphic. And she came up with a graphic that you and I have focused in on, Ken, over the years, that shows just the maze of things that mothers and fathers have to go through to get the services. That's our fault that it's so complicated like that. And it really speaks to something, again, that Commissioner Carter talked about this morning. So I'm gonna stop there. We've said a whole lot, and let us open it up for any questions anybody might have. Yes, and do we have a microphone? I have a mic here.
Yeah, we're gonna bring this.
We're gonna bring it.
Oh, no, I'm got one here, I got one here.
Actually, this question is for you. So we talked about Healthy Start. I came in a little late, but we know that the requirements were lowered. On one
Talk
end
louder,
for
talk
fathers.
louder.
The requirements were lowered for fathers. And it would also that the group health education requirements were increased. How can we shift our focus to serving more dads through group health education in these Healthy Start programs?
So,
That's the Ken question.
yeah, so just all those 115 Healthy Starts that have a father's required component, they were required to serve 100 dads in the last 5 years. And now in the new round, they've decreased the numbers. And I'm going to be honest, because of Healthy Start programs complaining that the number was too high. Just for context sake, these Healthy Start programs were required to serve 900 pregnant women. They only had to enroll 100 dads connected to those 900 women. But people were complaining, oh my God, we can't do this 100. How are we gonna do these 100? So I wanna put that context out. So for any Healthy Start program that failed to meet that 100, then we should have conversations on what happened there. So just because they lowered the number, just because there's other requirements, it should not hinder the fatherhood work. Before fatherhood was a required component of Healthy Start, those original 15 focused on fathers, were serving fathers, built partnerships to serve those fathers, and that's how fatherhood became a required component, because we're already doing the work. And so again, don't be defined by what they tell you can and cannot do. There's a requirement to serve. Geneva will confirm on it. You need to meet that number, but it doesn't mean you have to stop at that number. There's a way to serve your community and serve fathers connected to the Healthy Start mom and other fathers in that community. So again, don't be limited about what's been said. Meet the requirement, but you can go beyond that requirement. And even though the number has numbered, that shouldn't stop you. You shouldn't number. If I were at a Healthy Start, I wouldn't have my numbers lowered just because we don't have to serve 100. If I'm serving 100 mamas, I do not want to tell the world that I can only get 100 dads out of 900 women. That's a problem. Wouldn't you agree?
Okay.
All right.
There you go. Right? Other questions. Here we go.
How everybody doing today?
Good, good.
Good. My question is, I've seen that throughout this conference, we went to the system a lot for our systemic issues, correct? The question I have is, how can we, as Black folks, build a community amongst ourselves and have our own systems, especially since we keep on going to a system that's been oppressing us for years? How do we build our own systems and build our own community? As my brother up there said, one body.
Okay, let me respond to that. It's interesting. I used to be where you are with that thought. I don't know if any of you have ever heard of Dr. Frances Cress Welsing, you know, the late Frances Cress Welsing. And one of the things that she said that just made me understand how important it was to not isolate ourselves. She took me back to the pre-slavery, pre-Reconstruction period. And what she said to me is that I don't know if any of you know the history of John Brown, right? And she said, I'll take 12 John Browns any day, all right? And what she was basically saying that you can't do the work by yourself. It has to be in partnership. If you look at the history, even of the civil rights movement, that was not something that was divorced from what we needed in the Black community, but it was a partnership that we had with a whole diverse group of folks that helped us get that done. And I think that while we have to understand what our issues and problems are, I think the reality is that we have to work together with whoever wants to work with us in terms of advancing our various agendas. Going at it by yourself, going at it and thinking that that we can succeed, by just focusing in, quote unquote, on our own. I don't think that is for me, I don't think that's a plausible strategy. And let me say, I used to be there, but I realized that it takes all of us, working together to make a difference that we're trying to make. That's what I was saying.
Well, over here, then I'm going that side. So right here, then I'm going over there because I can stay over here because there's a lot of hands.
Good afternoon. I just want to make a quick comment. Being for someone I've worked in community action, I'm currently a Head Start director and executive director within a community action agency. Been there for over 20 years. What you are saying is so very true. Head Start and the community action agency is actually, it's a different lens now. They're actually reaching out for collaboration. They want the collaboration. They want the partnership. And the fathers, they are being left behind. So please, please reach out on a local level, on a state level, and on the national level, and get yourself out there, definitely.
All right.
Good reminder, good reminder. Dad doulas.
Mm-hmm.
Holy smokes, that is huge.
Mm-hmm.
We have 4 now in Washington State. What I want is times 100, but 4 is a great start. So the question is, the question is, how do we start getting through to hospitals and to folks who can keep them out? That dad, I mean, this is my work now. It's like trying to figure out how do we build a path and how do we get more dad doulas? So we're about to do a session, an online session about what you and I were just talking about around doulas, but it's really reprogramming people's thinking to dads need support too. And how do you successfully support your partner? So I think that's one of the collaborations we don't talk about. But one of our doulas, as soon as he got certified, he went to the hospital and they said, no, you can't come in here. So he went and found a different hospital, but that can't be the answer.
Right. And I want Kelly to respond to that, but let me just say a couple of things about the doulas. First of all, I think this is an excellent way in which to involve men in a different way as fathers and as men of the community. We also know there's not a lot of Black doulas, all right? There's a lot of doulas, but most doulas are women, all right? And we want to increase the number of men, particularly Black men, going into doulas. And if they're going to do it, you're going to have to pay them. You know, those are things, and at the same time, in the same ways that I talked about, you know, working with the courts and the lawyers, you know, working through these different associations, we got to work with the doctors the same way. We got to go to their conferences and we got to invite them to our conferences. That's why I'm so happy that I've been going over the last several years, Ken and I, to the maternal and child health, because when we go, we do workshops. And we educate, and then we get invited to come in to share it with a bigger group of folks, you know, back in their own communities. But I do think that that's something that we need to be doing and advocating for and creating more exposure for. Again, diversifying how we look at our work, you know, in terms of our work with fathers. Kelly.
Before Kelly, can I
Go-
say
go.
something? Because I'll come from a different perspective on the dad doulas, because I just want to speak truth. And I think we talk about doulas, people get excited about that. But there's advocacy that needs to be occurring for women doulas right now in hospitals. So before we jump onto the dad thing, people need to understand the advocacy that's needed for doulas in general,
Okay.
right? And so before that's just, and I want to support, we talk about father, we want to support that movement. Also, Kelly can emphasize this, but Healthy Start, we have dad doulas, do-bros, all kinds of things, but understand the culture of those dad doulas. I know dads that did a doula training. Why? Because I want to support my partner. So they did a training to learn how to better support her. There are dads that become full doulas, so they not only can support their partner, but now they can be a doula in the community. And again, the doula across those maternal care continuums. So the dads that are doing this are not doing just to say I'm a dad doula. They're doing it because either I want to support my partner. There are dad doulas that are training now, that brothers that who lost their sisters in maternal mortality, and so now they become doulas. And so spend time getting educated and learn before we just jump out there. But the advocacy at the hospital is another. We need to do that for fathers, period, before doulas, right? Because we have Amari Maynard, we have Charles Johnson working on advocacy for fathers in the hospitals. That's a fight that we need to stay focused on. We have baby-friendly hospitals, but part of the doula is one of those things that will come under making hospitals father-friendly. But I always say slow down, dad doula, because people get excited. But I'm like, they don't even know what's happening for our regular doulas not getting paid right.
All right, very good.
No, I love that, but I'll just add something else in a different thought. I agree with everything Ken said, but I also understand that the more aware and more institutionally and systemically precise we are in terms of what a woman is going through those phases, Because I actually did it to be able to prepare men to support women, at the same time understanding that I'm gonna need to do at least 6 to 7 births a year because I want to stay skilled at what I'm preparing and training people to do. And then the other component to that is one of our biggest hospitals in Charlotte, North Carolina, which is one of the 3 fastest cities growing in this country since 2007. They sponsored another program that I was in the cohort. And so that's my foot in the door. I'm engaging and having relationships with their medical doctors who have been very impressed with my understanding and knowledge of that process. And so that creates space and opportunity for more males to be able to go through the cohort, whether or not they decide to fully implement it. And then to Ken's point, in North Carolina, a part of Medicaid, they working on increasing payment for how much all doulas get. And then lastly, my goal is, to your point, I need a paternity ward, just like we have a maternity ward in a hospital, so that we have shared spaces to build real relationship when mom and dad may not be together, but they still have to co-parent, so that we kind of prepare young people, if they got other kids, that it's okay to co-parent and it's okay to emotionally support, make sure mom get informed consent, and that she's understanding that dad is advocating whether or not they are still a physical item. So those are the ways that I have been getting other hospitals to move in.
You can't do this. Explain, because I do think that the word doula is also a foreign term for a lot of folks who don't work in this space. So just explain what a doula is, just so everybody is operating from the same page, please.
Just quickly, the Greek word doula is a servant supporter. And so a doula usually goes into the home and the culture to help support in the house, support the woman. So in our context of maternal child health, a doula is someone who's supporting that mother before pregnancy, during pregnancy, and after. So you have prenatal doulas, you have postpartum doulas that, again, support women along and work with midwives and deliver babies.
Right. I'm saying that, and I asked me to do that, get used to that term, doula, all right? Dr. Anaji.
Okay, so we,
Pardon me? Oh,
Go
go,
ahead.
go, go.
Say
No,
this.
no, you go ahead. No, you go ahead.
back to you, but I just want to honor the hand.
Go.
So who's hand us?
Bobby, you want to go first?
So sometimes you have to start with the end in mind.
Mm-hmm.
So I don't think, since we have a lot of opposition in terms of birth doula, we should concentrate on postpartum doulas.
Okay.
Why? Because we know that 85% of the women who die when they come home.
Okay.
So the postpartum doula is that person who, I'm a doulo, and we say doulo with an O, masculine. I'm a doulo in training, working with those families when the baby and the mother comes home, so that father can do what? Be responsible to both the mother and the child. So the postpartum doulo is where we need to put our concentration, because that gives us more leverage, because that's when they need that support at that point. Thank you.
All right, thank you.
Yes, thank you. Yeah, and I just want to give a shout out to all the doulas and doulos. Both of my children, we had doulas, and it changed the game in terms of the birthing experience in the hospital. First off, I just want to say thank you, Ken, Kelly, and Dr. Johnson. You all are inspirations to me, and I'm sure many other folks in the field of fatherhood as I've been in it. So just thank you for your work, your steadfastness, and sharing with us. Thinking about, and I want to say, Brother Kelly, I appreciated you reframing. We often talk about trauma and intergenerational trauma, and I appreciated you reframing and saying we can also talk about intergenerational inheritance in terms of being kings and queens and passing down wisdom. Thinking about collective impact in this idea of like trauma and healing, though, one thing that I've noticed within the work is that oftentimes it can be hard to work together either in co-parenting relationships or in community when we're showing up with the baggage and the trauma. That it's hard to get along and talk about this collective strategic plan when we're literally showing up to the table with baggage and undealt with trauma. And so my question is, what suggestions may you have, or any of you, for how we can implement collective healing into our, community work and into this fatherhood work? How do we talk about collective healing as we're showing up and building strategies, getting to the bread? Where does healing and the collectiveness of that come in, or what ideas may we have around that?
That's what they're about.
Mhm.
And some of those folks that have curricula that actually deal. So it's integrating into the curricula is one way, and then some cultures and communities have healing circles. But again, one of the things we've learned over the years, looking at fatherhood curriculum, is when that's a part of it, because we know we come with baggage. And so if your curriculum is not helping men deal with where they are, focusing on health in the broadest sense, then you're gonna have the issues that were just described. But again, this conference is put together where we have folks that actually are addressing this. And so Jason Perry is standing up in the room. He just came in. His dad's endowment curricula deals with that brokenness and that need for healing with regards to that baggage. And so that's the way, getting men into those kind of programs. And if you're a practitioner, what curricula are you using that makes space for those healing circles is what I would say.
And I would just add that everything I do is centered in wellness. Because if we operate from the inside of ourselves, it's what's going to manifest on the outside. So myself, I have about 4 other people over there. Every month, we do something called the Father's Haven, where we bring food, barbers, and we have conversation. And that conversation is, we talk 2-generational, but we do multi-generational healing. And we bring young folk out there because they get to see what it's like to share, to be transparent. I'm not doing okay, and that's okay. How do we help support and lift that up, support them? And so what happens is, where historically they wouldn't share their feelings because, emotional wellness and mental health wasn't sexy 10 years ago, but it is now. Now, if we're not having those conversations, guys asking like, okay, when we're doing the next one. So if you inculcate healing in every workshop, in every training, and then you do something that centers it monthly or multiple times monthly, it then becomes muscle memory, and we get to prioritize balance, boundaries, self-care. And I don't mean the cliche is self-care, but as men, we need to find out those things that we love, what brings us balance, whether it's writing, whether it's gardening, riding horses, but making sure that we continue to communicate that, and that's something that's healthy for us.
Ladies and gentlemen, just give Ken Harris Kelly Little a hand. As we conclude this session, gentlemen, I think we've done our job. I think we've made the case for leverage, with diverse community organizations. There's a lot of work to be done, and that, as we cross-pollinate, we have a lot to learn about one another in the spaces of work that we're in, and to try that true common ground that allows us to work collectively. It is essential that we expand. Again, the way to do this is through partnership. It's always been that way, and that's what it's going to be in the future. It's interesting when you think about partnership and consistency. It's probably takes longer to do that, but it's the most effective. It's the most effective. And some of these things, and I like what Ken said, some of these things we have to be patient enough to understand that we don't get ahead of the game, because we need support, and we don't need to, try to move other initiatives out of the way while we're trying to figure out exactly what our role is, right? It's just so important. So in a way to do that is understand that some of the things we're trying to do, it truly is a marathon and not a sprint. It's going to take patience. It's going to take patience. We're trying to even work towards changing the habits of folks who've developed habits over many, many years. And so it takes time to do that. But thank you so much again for being a part of this session. And your workshop start in another 10 minutes or so. And so I want you to take your break one more set of workshops, and then we can go out there and enjoy DC and the Maryland area, and we'll see you in the morning. Good afternoon.